The neurotransmitter released from every preganglionic nerve terminal in the sympathetic division is acetylcholine. This causes excitation of the adrenergic postganglionic nerve and initiates the synthesis and release of norepinephrine from most postganglionic nerve terminals into the synapse between the neuron and the effector tissue. Norepinephrine, and sometimes epinephrine, binds to and stimulates the receptors found on the effector organs of the sympathetic nervous system. These tissues include primarily the smooth muscles of the intestines, uterus, and small arteries and veins, as well as glands and the cardiac muscle. Different effector tissues will have different types of receptors. The two types of adrenergic receptors are alpha and beta receptors. Certain effector tissues contain only A receptors, other tissues contain only B receptors, and still other tissues contain both A and B receptors. There are two subtypes of A adrenergic receptors, A1 and A2. A1 receptors are located on the smooth muscle of blood vessels and most organs such as the skin and salivary glands, eyes, intestines, and bladder, but not the heart muscle itself. The pharmacological effects of drugs acting on A1 receptors lead mostly to excitatory responses such as vasoconstriction, dilation of the pupils, urinary retention, and contraction of isolated smooth muscles. Because of the vasoconstrictive response, this leads to an increase in blood pressure and blood flow. The exception to this is within the intestines. A1 receptor activation leads to the relaxation of the intestines. A2 receptors are located on the axon terminal of postganglionic neurons that release norepinephrine. They're called autoreceptors. Stimulation of A2 receptors block further norepinephrine release, usually because the levels are already too high. This is considered a negative feedback. It decreases insulin secretion, blood pressure, and eye secretions. The general rule is that A receptors activate an excitatory or stimulating response, leading to an increase in vasoconstriction, for instance. Activation of the B receptors are primarily inhibitory or relaxing, leading to vasodilation, relaxation of the uterine muscles and bronchial tree, with the exception of the heart. There are three subtypes of B adrenergic receptors. The first is the B1 adrenergic receptor. This is located on cardiac tissue. When activated, it produces heart stimulation, leading to increased heart rate and force. B1 receptors are equally responsive to epinephrine and norepinephrine. B2 adrenergic receptors are located on the smooth muscle of all organs except the heart muscles, such as the bronchioles, skeletal muscles, and blood vessels supplying the heart and kidneys, eyes, and uterus. Activation of these have an inhibitory effect, causing relaxation of the smooth muscle, decreased blood pressure, and bronchodilation. B2 receptors are more responsive to epinephrine than norepinephrine. Acetylcholine is the neurotransmitter released from the parasympathetic presynaptic and postsynaptic nerves. Acetylcholine binds to and acts on cholinergic receptors contained in the postsynaptic nerve and the effector tissue. There are two types of cholinergic receptors. Muscarinic receptors are located in tissue innervated by parasympathetic postganglionic nerves, which innervate smooth muscle and sweat glands. When they're activated, muscarinic receptors initiate smooth muscle contractions such as bronchoconstriction, increased gastrointestinal motility, and gland secretions such as salivation and tears, and decreased cardiac function. Nicotinic receptors are located on skeletal muscle. Activation of these receptors cause muscle contraction. There aren't many pharmacological applications for stimulating nicotinic receptors. Other types of neurotransmitters and receptors include dopamine. Dopamine receptors are activated by dopamine, but not other adrenergic receptor agonists. There are 5 classes of dopamine receptors, D1 through D5, which mediate muscle relaxation of vascular smooth muscle and regulate neurotransmitter release. Dopamine plays an important role in the pathogenesis and treatment of certain brain disorders such as Parkinson's and schizophrenia. A number of antipsychotic drugs act as antagonists of the dopamine receptor, preventing dopamine from attaching. Another is serotonin. There are more than 15 types of serotonin receptors. Serotonin is a neurotransmitter produced by platelets, cells in the gastrointestinal tract, and neurons. It serves to stimulate gastrointestinal motility, vasoconstriction, and control sleep, pain, behavior, and emotions such as depression. Certain drugs can act to affect the synthesis, storage, release, and reuptake of serotonin.